Hello, good morning, my viewers. Today, on our health tip, we'll be talking about female or women's health. And the topic on the women's health we're to talk about today is postpartum paralysis. Postpartum paralysis, that means a condition that occurs after birth in some women. Postpartum means after birth paralysis, weakness that occurs in women or some women after birth. Not all women, but some. What are the causes of this paralysis? It can be as a result of the excessive size of the baby. It can also be as a result of also called hydrocephalus. Hydrocephalus is a situation, a condition whereby the baby has enough fluid contained or retained in the ventricles of the brain, making the head to look so big. So when the baby is now being delivered through what we call SV, the safe vated delivery, okay, the baby coming out, the head or the size of the baby, if it's too big, we press on the woman's, what we call the sacral plexus, because as the baby is coming out, it depends on the dilation of the os. So, dilation of the cervix actually. So as the baby is coming out, okay, if the head is big or the body is so big, it tends to impinge on the walls of the sacral plexus. The sacral plexus is the origin where the nerve supply to the lower limbs or to the legs of the female or the human being comes from. So when there is a compression at that sacral plexus, it affects the nerve supply to the lower limbs. This compression or this damage to the nerve can be in three forms. Number one is called neuropraxia, that's partial compression. Number two is called axonotmesis, that is like a chunk or maybe a bit of rupture on the nerve supply or the sacral plexus. And then the last one is called neurotmesis, that is total transection of the nerve. If it's just neuropraxia, the woman recovers back after 6 to 8 months. If it's axonotmesis, that is second stage, the woman recovers at times a year or a year plus. But if it is neurotmesis, some then tend to recover. That is a total transection of the nerve, except something happens differently. Now, for this to occur, it also depends on the type of pelvis that woman is having. There are some females that has male pelvis. We have, I think, majorly 3 types of pelvis. We have the android pelvis, we have the gynecoid pelvis, and we have the platypelloid pelvis. Android pelvis is for male,